Hi, my name is Khadijah.
Hi, I'm Priya. Nice to meet you.
Hi.
I'm Laina. Nice to meet you.
I'm a nursing student at the College of Rockford, and I'll be taking her heartbeat and temperature today.
Okay.
Thank you. Okay, that sounds good. So, how's she been?
She's been good.
That's good. How old is she now?
2 weeks.
2 weeks. Emily, you delivered, right?
Yep.
How's the recovery been?
It's been pretty good. We had a natural
Good.
delivery.
Okay, the temperature looks good too. Dr. Laina will be here in a couple minutes, and I'll be sitting in one of the observations, if that's okay.
Yep.
Hello, how are we doing today?
Good.
Hi, I'm Dr. Laina. Nice to meet you. So I understand we are here to go over for Sally's 2-week checkup today. Okay. So we're just going to go through a routine assessment, checking her reflexes today. We're going to be going over 3 separate reflexes, and I'll explain them as I go through them. Just to give you a little bit of information about newborn reflexes, they're just an automatic response to a particular form of stimulus. So I will be stimulating 3 different parts of her body to see how she reacts to them, okay? So the first reflex we're going to be testing today is called the palmar grasp. It is when the center of the hand is stimulated and the baby curls their fingers in. It's meant to help prepare them for the future when they are starting to grab onto objects. So that looks good. Okay, and the second reflex we're going to be testing is called rooting. That's when the cheek is stimulated and the baby turns their head in that same direction. It's usually searching for food. Okay, and the final reflex we're going to be testing today is called the Babinski. That is when the baby's foot is stimulated from heel to toe, and they spread their toes out and then curl them in tight. Okay, so that looks good. It looks like she is on a healthy path of development. There we go. Now I understand that you two are new parents, so I just wanted to open up this time for you guys to ask any questions that you may have.
We've been having trouble soothing the baby, so I wanted to know if you have any strategies that we can use to soothe her.
Okay. Well, definitely after making sure she's been changed and fed, 2 possible ways to soothe her would be 1, massaging her body. That will help relax her and she'll most likely fall asleep. So just gently massage her from head to toe. A second recommendation I have would be to go on a car ride. Usually the motion of the vehicle will help calm her down and she'll fall right asleep.
Okay. And in terms of development, what can we expect in the next 2 to 4 months?
Well, there's 2 different kinds of motor skill development. There's gross motor skill and there's fine motor skill. Gross motor skill is the larger movements, so that would be things such as like holding up her head. That'll start at about 2 months. That she'll also start to hold up her torso. She'll basically stand herself up on her forearms and look around at her environment. Then she'll also start to develop fine motor skills, which would be smaller movements, such as grabbing things and most likely putting them in her mouth, so be careful for some small objects. She'll also start to roll over, so it's usually from her tummy to her back, so just be aware of that. And she'll also start to make more noise, so you'll hear a lot more babbling and cooing, and it's like she's talking to you. So, okay. Any other questions?
Yeah, I'm going to be going back to work soon, so we're going to be looking for daycare providers. Do you have any tips on that?
Khadijah is actually a student at the College of Rockford, and she's studying this right now, so I'm going to let her answer those questions for you.
Okay. Some of our friends have been worried about the amount of attention that they get at their daycare facilities. So do you know like the appropriate amount of children for each daycare provider?
Well, in a good daycare, there's usually only supposed to be 1 caregiver for 3 infants. And in 1 room, there's only supposed to be 2 caregivers for 6 infants. So look for that when you're looking at childcare places. And also when your child gets older, there's 1 caregiver to 6 toddlers. Okay?
Okay. And what kind of qualifications should we be looking for?
You should always look for a caregiver that is first aid and CPR certified, so they know what to do if something happens to your child, like choking or anything related to that. And you should also look for a caregiver that is trained and educated in child care.
Okay, thank you. Thank you very much.
Do you have any other questions today?
Nothing.
Well, if you do have any questions, please feel free to call our office anytime, and we'll be happy to answer them for you. It was great to meet you. Good luck.
Thank you.
Nice to meet you.
Nice to meet you.